Good afternoon, thank you, and welcome for our April in-services. Today we actually have Ms. Gail Oglesby Ricks, who is the President and CEO of Growing Homes Southeast. Ms. Ricks is here to share with us what her program is about and how it may be able to assist us. So without any further ado, Ms. Gail Oglesby Ricks.
Thank you, Mr. Washington. I appreciate it. I brought really a flyer from our agency to kind of give you a sort of an overview of the services that we provide at Growing Home Southeast. And again, and thanks, Mr. Washington, for inviting me to provide you with information. Talking about Growing Home Southeast and what we do is one of my favorite things to do, so I'm just happy to be here today. The information that you have received, Growing Home Southeast is a statewide family service agency. We are a nonprofit organization. We're members. We're affiliated with the United Way of the Midlands, as well as accredited by the Council on Accreditation. And we are members of the Foster Family-Based Treatment Association, the Alliance of Children and Families, which are national family service affiliates. And we're also members of the South Carolina Association of Children's Homes and Family Services. That's a long name. In fact, I'm on that board. And we provide a variety of services across South Carolina. Our largest service is treatment foster care. This is a form of foster care for children who are experiencing very difficult situations. They're the children that unfortunately we read about in the newspaper or that are advertised or talked about in the media in regards to abuse and neglect. So these are very high-end, very involved children. We also provide medically fragile foster care, which is provided for those children who have intense medical needs that would otherwise be serviced in a hospital or some sort of institutional setting. But we place them in foster homes with trained staff, generally trained foster parents, generally foster parents who have some sort of medical experience. And those children are placed in foster homes as well. We also do home-based treatment services. This is intensive family services for those children that are living at home with their parents or their permanent family. We go in and we provide a lot of supportive services. Those services are provided actually in the home or in the school or wherever the need dictates. We also provide, we have two new services that I wanted to also mention. We also just started providing kinship navigator services, and these are services for children who are in foster care and the state is looking for a permanent home for them, and they're looking, when their biological families cannot take them back on a permanent basis, they're looking for kin or people that are related to these children. And our staff go in and talk to the kinship person or the relative to really give them a clear idea of the need of the child that they're going to be taking into their home, and also to acquaint them with the support services that are out there to make certain that this transition will be permanent and will have as few problems and issues as possible. We also do family group conferencing, where we are involved again with talking to families who are going to receive their kids about the problems that certainly will exist with those children coming back home, and helping that biological family get the needed support that they need in order to make the permanency for their children that are returning, well, permanent. So those are basically the services that we provide at Growing Home Southeast. One of the things that I wanted to raise, unless you have questions, do you have any questions at all?
Well, just for information purposes, how long have you been affiliated with United Way?
We have been affiliated with United Way probably since 2005, I believe.
Or did you do an RFP?
We have done, yes. In fact, we have received funds. I did leave out one program, which I don't know why I didn't remember that. Our supportive housing program. We own a 20-unit apartment complex in West Columbia. These are one-bedroom, fully furnished apartments, and we provide these apartments for young adults who are leaving some sort of out-of-home care. They could have been in foster care. They could have actually been in the custody of DJJ or in a mental health facility or some sort of care away from their family. These are for 18, they must be 18 years or older. They must have an identified disability. And the apartments are, I think I did say single one-bedroom apartments. And our agency is the owner of the apartment, and we basically provide some supportive services, skill building, that kind of thing. But the unique thing about the program is that we've partnered with Lexington County Community Mental Health Center, and they provide us with a case manager who is on site and provides case management for the young adults that live at the apartment complex. They also, interestingly enough, the Department of Mental Health, if the tenant qualifies, can get or receive rental subsidy for that apartment. They must qualify according to their disability standards. And all tenants must pay a portion of their income towards their rent, even though in most cases they're getting or receiving a rental subsidy. Their qualifications, certainly you can go on our website and look at that, but one of the things that we do require all of our tenants to do is to be involved in at least 25 hours of productive activity each week. We know that idle young people are not a good thing, so they've got to be in school, they're working, they can volunteer for portions of those 24 hours, and some of them are also in day programs. So today we have, I think, we're almost completely full. We have 20 apartments, and generally they stay full, and we have a waiting list as well. But that's an additional program that we have that I forgot to mention. Yes?
Is that long-term or short-term?
They're actually, on most of the apartments, there is no time limit. These can be permanent apartments. As I said, we're the owners. We manage it just like anyone would manage an apartment. Of course, there's some interesting things that go on that you wouldn't expect at an apartment complex. But there are some apartments, and there are apartments that were funded by HUD, and they are specific for short-term use to eliminate homelessness, and they're up to 2 years. But we're not kicking anybody out. We don't physically move them, but on our rolls we'll move them to a more permanent apartment, which there is no time limit. We have them sign a 3-month lease when they first arrive, because generally the turnover is pretty interesting. It's a lot quicker than most apartment complexes. So they sign a 3-month lease, and then they will have a month-to-month lease after that. But we have tenants there now that have been there over a year. We just opened in September. I think we took in our first tenants in September of '08. I have a terrible memory, but I think that's right. So we've been there a little over a year. So we've had tenants that moved in soon after we opened and are still there. Are there any other questions before I move on? Yes.
The foster care services you were talking about, I'm assuming that you work directly with DSS and use their foster cares that are licensed, and you just match them with. How does that work?
We are a separate entity. While we receive the majority of our referrals from the Department of Social Services, we are independent in that we go out and we recruit our own foster parents.
Okay.
We have about 250 foster parents across the state of South Carolina that we have recruited, we train, we keep them licensed according to the DSS licensing standards. But in fact, because we are accredited, our standards are much higher than what DSS requires. So for instance, DSS requires that foster parents receive 14 hours of training every year. We require that they receive 25 hours of training every year. They must have 30 hours of training outside of first aid and CPR and first aid. 30 hours outside of CPR and first aid when they first come to us, before they take their first placement. And then every year thereafter, I think they're required, I think it's 24 hours that they're required of training to complete. So DSS, we don't have the same foster parents because the kids are going to be a little more involved. They're going to be much more complicated than regular foster care. So our staff provides 24/7 support to our foster parents. We are available on a 24-hour, 7-day-a-week basis. And that might be a little bit different. We're visiting the home probably anywhere from every week. We're talking to foster parents with very difficult children probably almost every day by phone, and we are there in the house, in the home on a very regular basis. A little bit different than regular foster care. Yes.
The compensation that most foster care families receive,
Mm-hmm.
so if you're licensing your own foster care homes, does that compensation come from you, from your organization? And how does that
To license
compare?
the homes?
Well, for being foster parents.
Oh, I see. Our reimbursement rate certainly is higher than regular foster care
Okay.
because our
So
foster
there's higher
parents are required
requirements.
to do far more. I mean, everything from documentation to training. They receive more than they would, probably twice as much as a regular foster family
I would think
receive.
that's where a bunch of your funding goes out
Mhm.
to.
Mhm.
Okay.
Are there any other questions? These are good questions. Keeps me from having to think of everything. And clearly, I hadn't thought of it. If I had forgot our supportive housing program, I raised the $1.8 million to build the thing, so you would think I would remember it. Anyway.
Now, did you mention that most of your kids are regular foster care, or your children are basically therapeutic?
Our children are therapeutic.
Okay.
Now I would say we probably have a small number of regular foster children. For instance, with sibling groups, we do not advocate splitting up sibling groups. If therapeutically they could live together, one child might be therapeutic, the other child might be regular foster care. So both of those children, with the agreement from DSS, both of those children could be placed in one of our foster homes. We do have a few. It doesn't happen very often, but occasionally we will have a teenage mother who's therapeutic. She has a child, and both of them could go into one of our foster homes as well.
Now, these are children who are in the custody of the state or custody of the parents?
I would say all of our children are in the custody of the state. That doesn't rule out the possibility. Of course, this is a very expensive service. If a family could afford therapeutic foster care, certainly we would consider placing their children. But I don't know that has ever happened, that we have actually taken private pay for foster care services. It would be extremely financially unfeasible for a family to do that. And if a family could afford that, I suspect that it would be, a different way to maneuver something like that, maybe through their insurance or perhaps a respite kind of relief service, and then go into the home and provide supportive services so that child could stay there. While our largest program is treatment foster care, we believe that kids should be in families, and they certainly should be in permanent families. And we are always encouraging, in fact, our foster parents adopt. The highest number of adoptions in our agency happens with the foster parents who have been with these kids or had these kids for a period of time. And it's a huge celebration in our agency. We send flowers, we have a party, that kind of thing. So we're always promoting permanency with children in our care. And occasionally, foster care could be the permanency plan for some kids. But ideally, we'd like to celebrate kids going out and living with their own families, or certainly people that have chosen to adopt them.
So in terms of collaboration with your sister agencies like the Apps and Mentor, where does Growing Home fit into this?
Those are certainly our competitors, and I'll be very honest about it. But I would say that, unfortunately, there are over 5,000 children in foster care in the state of South Carolina. And probably of that number, I'd say about 2,000 kids, unfortunately, would fit the category of needing some sort of higher level of care, a therapeutic kind of setting. So there's no fighting among organizations, because again there are unfortunately so many kids that need services. I would say that from a quality standpoint, we believe that we're probably the best in the state. So, and we have outcomes to prove it. We publish our outcomes in our biannual report that goes out to the community, and I'll begin to include you guys on that mailing list that get that information. We send it out every other year. But we set ourselves to a standard, and we definitely test that standard on a daily basis as to whether we're meeting it. I report to my board of directors at least twice a year about our program outcomes as well as our strategic outcomes that have been developed for the organization. So from that standpoint, we feel like we're the best. And you know, as I said, we have over 250 foster homes across the state. And I would say, I would point out a couple of things, and this was part of my message today, talking about the importance of advocacy and what you guys do with kids that are in foster care. I think probably more than any other time that I've experienced, advocacy for these children is very, very important given the current economic situation that we're facing in the state of South Carolina. You know, the thing that people are looking at, particularly from the state's end, is finding ways to reduce cost. And certainly I think that's, I teach a class at the university around resource development, and we talk about budgeting and cost saving measures and all of those kinds of things. So I think that's great across the board. We shouldn't be cost saving just in economic crises. We should find ways to cut costs all the time. I think that's I'm fairly conservative as it relates to the financial management of organizations, and I think our state doesn't always do that great in that regard. So I'm not against cost saving, but what I am concerned about is that children might end up on the short end of this because their services are cut, or the time, for instance, that they're in foster care while they need to continue their therapeutic treatment, that might be cut short because we need to save costs. So as advocates, I would strongly recommend that you get involved, particularly when there are meetings around developing a plan for the kids in care. If there's any sort of planning meeting that's called by either your DSS worker or the program agency worker to talk about the child's placement, that definitely their advocates need to be involved, so that the kids don't end up on the short end of this, that making sure that they get the best and good quality services so that they are able to go back home if that is the plan for them, or they're adoptable if that's the plan. But the bottom line being that we want kids to get the best services and not get cut short because of the economic situation. And that was a long way to answer your question, but I wanted to get that in. Are there other questions? I think a couple of other things that I wanted to raise is, again, you're being very vigilant in assuring that children are getting the best services and the best care possible in the state. I also would point out that, you know, the Department of Social Services gets a federal review every year, and I think they've made this public, and they are really struggling to address issues that the federal government requires them to address around safety, permanency, and well-being. And you should be aware that the state of South Carolina didn't do that well on this last review from the feds. And one of the things that I certainly advocate for is to help DSS develop services, develop programs, or think about ways that they might be able to do better on some of the requirements that they must meet according to the federal government. And one of the things that I am always pushing is looking at ways to provide preventive services on the front end, so that these children do not have to go into foster care. When I talk to people, I have not been in foster care. I grew up in a family situation that was probably over the top, and I'm probably totally irresponsible as a result of that. I grew up as a child of divorced parents, And it seems that my grandparents overcompensated, I'm assuming, for the fact that my parents divorced. So on both ends, my mom's family and my father's family, my sister and I were just absolutely, my grandparents were, if that's possible, it appeared that they worshiped the ground that we walked on. So I don't come from any underprivileged kind of thing.
So they spoiled you?
Oh my gosh, when I look back on it, I think that was not the way they should have done this. But what was interesting, I spent summers with my father's family in Atlanta, and just spoiled, and I'm trying to remember why I went to that point. But the issue for me is that if we could identify, and certainly we have done that, we know those families that are very vulnerable, that are having struggles with raising their children, and if we could get to them early on, put in a lot of support, provide services for those families, those children would never have to go into foster care. It'd make my job a lot easier. It certainly would make your job a lot easier. And that is something that I wish more and more that we could get support to advocate for those kinds of preventive services that could prevent, they'd be cheaper. If you think about what it costs to put a kid in foster care, and in some instances we know of kids that have been in care their entire lives. They've gone into care at very young ages and actually age out of foster care at either 18 or 21, depending on if they're in college or whatnot. So clearly advocacy around prevention programs is something that I would ask you to do. Because that certainly, now if a child is not safe in a home, we do know that some children must go into foster care, and in some instances should probably never return home if that family has not made some changes. And we even say, even if the child has to go in care, let's find ways to work with that family. And I think it happens in some instances, but it's not pervasive at DSS, and that is something that I would clearly, if you have an opportunity to advocate in any way, that's certainly something that I would appreciate. Any other questions?
I'd like to make a comment on that
Sure.
fact, which really I have been kind of mesmerized, I guess, about in the system is, and I've had 2 cases with families that the kids were not abused as to abuse-wise.
Mhm.
They were lacking the basic essentials to come above, and because of the economy and the way things are, they could sustain, but they couldn't obtain because of the upfront fees that they
Mhm.
needed.
Mhm.
And in both cases, that the kids were pulled out of the home because of the degraded situation they lived in, but
Mhm.
at the same time, the kids were happy
Mhm.
with, they were taken care of to the best possible way. And it really befuddled me that they would place the kids in foster care, but refuse to give the actual family
Mhm.
any
The
help,
help
to
that they
obtain.
needed. Yeah, yeah.
The assistance
And
that they
that's
would-
certainly,
You understand,
that,
but
yeah.
they'll spend $2,400 a month on giving somebody else to take care of somebody's kid, but wouldn't
Well,
give them $700
Yeah.
to help obtain something. That don't make any sense.
And certainly, we get to the system that we have through many ways. I mean, it's not as simple. It's not a one. Going from one point to another plan. It's kind of convoluted. I certainly understand the need to make sure that children, and in some ways that could be determined that children are neglected in some ways. There's a certain standard that children should receive, but you are correct that even if you do end up placing children out of their homes, that there ought to be some mechanism that can go in and help that family find ways to get those children back in the home and maintain them so that they don't have to get involved with the Department of Social Services. I mean, I think probably all of us sitting around the table have never had people come into our home and judge us about anything that we were doing one way or another. I mean, that's, I'm sure, a very intrusive kind of situation. And I would hope that in the most serious cases is where folks have to have their, people end up having their children removed. But you're correct that it would be great to find ways to work with those families.
Right. I mean, to me, it makes no sense.
And as I mentioned, we have a program called home-based or in-home counseling. And that's what we do, but unfortunately, we don't get a lot of cases from DSS. We get those cases generally from the Department of Juvenile Justice. These kids are leaving juvenile justice custody and going back home. So when that child comes home, we go in and help that family, first of all, receive that child, make sure the transition works well, and then we wrap services around that family for several weeks, or actually several months after the child returns home. And to my knowledge, we have had very few situations where the child has had to leave the home. We probably have, our recidivism rate probably is in the single digits, because those families are getting everything. I mean, we're helping them access services in the community. We're doing parenting with them. We are interacting over dinner. Anything that that family needs, we're going in. Sometimes we're there. We could be there 12, 13 hours a week with that family, whatever that family needs to help. We help mothers and fathers get jobs if that's one of the problems that exist in the family. So we're doing just a range of services. Whatever that family needs, we're trying to go in and help them provide, help them get that. So I think your point is well taken, that it would be great if we had something on the front end that, you know, would even prevent these children from having to go into out-of-home placement.
And you said a lot of your cases come from DJJ. When you have cases, I mean, I know you've had to have at least some cases where when you actually visit with the family, you can't find where they've actually done anything wrong. The parents have jobs, they're raising their children to the best of their abilities. The house is clean. Don't you have cases where the child ended up in DJJ just because they were acting out?
Oh, I think in many cases that's the situation, but I would say that the family needs help with dealing with either those acting out behaviors or criminal behaviors, because otherwise those children will end up out of the home again. I mean, and 9 times out of 10, these families want these children back home. Now, and I will say that in some cases, probably half of them or more, the focus is on the child, when in fact there are all kinds of things going on in the family. Now, the child certainly is acting out, the child is certainly getting in trouble, but 9 times out of 10, there's stuff going on in that family that is the child's behavior overshadows those kinds of family dynamics that are going on. I mean, we all know families. I mean, we were raised in families, and we know that there's stuff going on. I have a situation, I don't even want to talk about it. But the dynamics that go on in families certainly attribute, have some attributing factors to why kids act out. But kids just act out because that's the stage that they're in and they're supposed to act out. Unfortunately, kids can get into a lot of trouble as a result of that, and families are just not able to handle those situations. So our whole point is to go in and help them receive those kids and help them keep those kids in their homes and keep those kids out of trouble. Yeah. Yes?
But it could probably affect a lot of agencies, particularly DSS and DJJ. Has it affected your quality of services to your clients?
It has not. That's one of the things that I am just totally and completely committed to, not reducing the quality of our services, even given the fact that we are getting budget cuts. What I have seen is that children are leaving our care a lot quicker than they have, I'd say 2 years ago. Not to say that we want kids to languish in foster care, but we certainly want kids to be there until they are better and that the permanent home is prepared to take them back. But I'll give you an example of how we have absorbed some of the budget cuts that we've received. In fact, it was very interesting. As I was at my mom's house on the day after Christmas, I got an email from someone at DSS saying that because of the budget cuts that they had received, they were cutting our budget, our daily rates by 9%. And that's a lot. I mean, when I went back with my CFO, it's like, oh my goodness. So what we decided to do is that our foster parents are the most important piece of all that we do, so we cannot pass on all of this cut to them. So what we did we did pass on 2% to our foster parents. My office or my administrative staff, the corporate office staff, we are required to take a furlough day, myself included, between, our budget runs from July to June. So right now, between February and June, all of my corporate office or administrative staff are taking 1 day a month, five furlough days. And we found ways to reduce our travel costs, because that's a huge amount besides staff or cost, because we're statewide, and while our workers are out across the state, that's a huge that has a huge impact to our budget. So we found ways to reduce some of those costs to make more home visits on a particular day, so that you're not out on, every day. So those have been the ways that we did cut training. Well, we also cut training. I'm not going, I usually go to training, 2 or 3 trainings nationally every year. That's not going to happen this year. So we did find a way, and again, nothing that I said to you is about reducing the quality of the services that we're providing. I don't like these furlough days. I really do not. But that was a way for us to make the effort to reduce our costs rather than the quality. None of our workers out in the field experienced any major reduction of what they do, other than trying to be more efficient around their travel.
So you base it on referral agency, other agency refer cases to you?
Pardon?
Other agencies make the referrals to your agency?
We get, principally our referrals come from the Department of Social Services, but we also get referrals from the Continuum of Care, DMH. We don't get very many referrals from mental health, I must say, but we also get referrals from disability and special needs. And we are just about to begin a new service that the Department of Health and Human Services and DSS has asked us to provide, and it's care for adults, foster care for adults. They have just issued a new contract that we will, in fact, we're going to model this program. We're going to take our first adult in the next few weeks. These are adults that have been reports of abuse and neglect, but they are adults. And the model is very similar to the services that we provide to children. So we're going to take some of these adults into our foster homes as well. Is the first, well, actually it's the second service that we're providing to adults. Our apartment complex is adults as well, but
that is a growing need. Geriatrics is a growing need for social services as is. So.
Yeah. Any other questions? These have been good questions.
Well, if you could distinguish your program, say, from MTS or whatever it is they call themselves now, what makes your program a little better than what the state has provided through their therapeutic program?
I think the state has MTS or IFCSS.
Help me with the initials.
It's Intensive Family Services Community. I don't know. I can never. It's the old MTS. That's what I learned, and for some reason I can't get it out of my brain. They have a couple, or they have a treatment foster care program, or they don't call it treatment foster care because they don't quite provide the same level of services that we provide. They call it, I think, specialized foster care is what the state program is called. But I think it's a very small program, and they have targeted a very